Comparative healthcare structures of Costa Rica and Tuvalu. Demographics and geography. Costa Rica is located in Central America, bordering Nicaragua and Panama. Population is 5.2 million people, with an equal distribution of men and women. The predominant religion is Roman Catholic, and the official language is Spanish. Tuvalu is located in the South Pacific, halfway between Hawaii and Australia, with a population of 11,000 people, with an equal distribution of men and women. The predominant religion is Protestant, and the official language is English and Tuvaluan. Ethnic groups. Costa Rica has overwhelmingly majority white or mestizo, and Tuvalu is majority Tuvaluan. Life expectancy. For Costa Rica, the average life expectancy is 80 years, while the average life expectancy in Tuvalu is 69 years. The age distribution of Costa Rica, majority of the population is in the 15 to 64 years category, and they have a relatively small 65-year and older population. Tuvalu, which has a large 15 to 64-year population and a larger geriatric population as compared to Costa Rica. Healthcare structure of Costa Rica. It is a mixed system of both public and private insurance. It's ranked number 36 by the World Health Organization, and it's number 2 in the Americas after Canada. Their predominant public insurance is the CCSS. It is a public system, and it's a near universal healthcare coverage with 95% of citizens insured. It is funded via progressive tax income, ranging from 7 to 11% of income, and private insurance premiums range between $60 and $250 per month. 7.6% of the GDP goes towards healthcare, with the total GDP in 2024 being $95 billion. The per capita expense is around $978. Medical facilities and staffing. There are 15 public hospitals administered by the CCSS. There are 4 private hospitals, over 250 public clinics, 7 medical schools, 8 nursing programs. One important aspect of the CCSS is the EBAIS program, which provides comprehensive and coordinated primary care. There are teams of doctors, nurse assistants, medical clerks, technical assistants, which function as social work. All citizens are assigned a team and receive a minimum of 1 home visit per year. Additional support, if needed, of nutritionists, psychiatrists, and pharmacists. This creation of this program in 1995 has increased access to citizens and has contributed to increased life expectancy. Costa Rica has similar long-term care and home-based care as compared to the United States, which includes nursing homes, home-based care, assisted living, and adult daycare facilities. Of note, the CCSS does not cover long-term care, and patients must pay out of pocket, which is definitely a limiting factor in the country. One program that they have is the Red Cuido, which is a government-subsidized home-based care program that provides for a low-income geriatric population. National reform currently going on are improving the EBAIS program, increasing the supply of nutritionists, continued digitalization of medical records, decreasing rates of non-communicable disease, and improving geriatric care. Healthcare structure of Tuvalu. It is a government-funded universal healthcare system or single-payer system. There is no private sector in the country. All citizens of Tuvalu have medical coverage that covers primary care, preventative, medication, and hospital admissions. Citizens pay about 30% of their income tax as long as they pass a certain threshold of $1,900. 20% of their GDP goes towards healthcare, which is a relatively large amount of the GDP to go to healthcare, but they have a relatively low GDP of only $62 million. Their per capita expense is around $1,085. Medical facilities and staffing. There's only 1 hospital located on the main island of Funafuti. There's 2 health clinics on the main island, and there's 8 health clinics on the other islands that mostly function as urgent cares and are run by the nursing staff. Tuvalu does not have its own medical school and relies on foreign-trained doctors to become licensed in the country. There's also no established nursing program in the country, and they collaborate with Fiji or Samoan nursing programs. Medical services. Funafuti is a 50-bed hospital. It includes primary care offices and 1 dental clinic, as well as admission capabilities. It received its first ever CAT scan in 2023. Teams that they have are internal medicine, anesthesia, OBGYN, and general surgery. Due to the limited physicians in the country, they rely on locum physicians from other countries such as Taiwan or Cuba. And for more advanced imaging or complex surgeries or specialists, they go to neighboring countries of Fiji or New Zealand. Unfortunately, there are no long-term care services, assisted living facilities, or nursing homes on Tuvalu. Culturally, the community takes care of each other to provide as much support as possible. If long-term care is needed, they stay admitted in the hospital. There is a program called Elderly Scheme where the government contributes $100 per month to citizens 60 years or older to help with poverty and other expenses. National health reforms going on in the country right now are increasing clinics and improving medical capabilities at the hospital to combat non-communicable disease. They are renovating their only operating room. They are improving their crops to affect nutrition and combat poor and undernutrition. They have also worked with other countries such as Taiwan to increase their agricultural tools. And they recently bought Starlink, which is a satellite internet company, which helps them to convert electronic charts, improve communication between clinics, and start providing telehealth services. In regards to Costa Rica, we can learn the establishment of a near universal healthcare system while having a mixed public and private healthcare system, the creation of primary care and preventative medical teams that do house visits to improve access, life expectancy, and morbidity and mortality, and the emphasis on generic medications and narrow formularies to keep costs down. For Tuvalu, the establishment of a universal healthcare system, the importance of community support in the geriatric population or just disabled population, and otherwise the restructuring and new education on nutrition to decrease non-communicable disease. Overall, both countries vary greatly in their overall GDP and population size, but provide similar universal healthcare for nearly all citizens. Tuvalu relies heavily on foreign aid and outsourcing regarding complex patients, and Costa Rica is independent functioning and has modern-day capabilities similar to the United States. Similarly, both of the countries focus on preventative and primary care efforts to decrease non-communicable disease and increase life expectancy, which will ultimately keep costs down.